sounds as if EngenderHealth is finds that as a big priority for the Obama administration. Are there other action steps that you would like to see?
Definitely. We want the gag rule to be lifted. The gag rule provides funding for family planning, but we also know that for many years now, the funding has been limited, but the demand has increased. There is a large youth population that is going to hit reproductive age very soon. And so not only do we want the gag rule lifted, we want the funding for family planning to be significantly increased. So many women are still dying. A woman dies every 1 minute from a pregnancy or delivery-related cause. And yet we know what needs to be done to stop these women from dying. The resources are limited. So we will also be appealing to the new administration to pay more attention and increase funding for maternal health. The U.S. government is putting in a lot of money into HIV prevention, care, and treatment, and they need to be recognized and congratulated for that. But they've also put some restrictions that make these resources less effective. The focus on abstinence for prevention needs to be lifted so that people can make choices of the prevention methods that best fit them. They also need to lift the restriction of funding to organizations that work with sex workers or prostitutes. These are a group of people who are at high risk, but there is also restriction of funding to organizations, the HIV funding to organizations that work with sex workers and prostitutes. Yes. And so we would also like these to be lifted, the HIV funding to continue, but these to be lifted so that the funding can become more effective. And we also would like the administration to focus attention and resources on the reproductive health needs of young people.
And I think we've also had guests on previous programs of Future Choices about the importance of funding the UNFPA again. Does EngenderHealth work with UNFPA?
Yes, we work with UNFPA, and UNFPA works with all the governments with which EngenderHealth works. And they provide a lot of support and technical assistance to the Ministry of Health in design and implementation of their reproductive health programs. And so their activities have been limited because they received very significant support from the U.S. government, which also has been cut in the last several years. So reinstating the funding to UNFPA will also be one of the priorities we hope the administration will deal with.
And that's been throughout also the last eight years that the UNFPA has not been funded.
They've not been funded.
Okay, so another action step for Obama. Well, you certainly have made it clear that EngenderHealth is involved in a wide variety of activities as far as helping other health institutions in developing countries to improve their services in HIV/AIDS, in maternal health care, in family planning, etc. But all the action steps that you just talked about, asking the president to do, were governmental action steps. Is all of EngenderHealth's work funded purely by the federal government?
No, we receive a significant amount of support from the U.S. government. A lot of our programs are funded by the U.S. government, but we also do get funding from foundations, from corporations, and from individuals.
So that when anybody goes to the EngenderHealth website to sign the petition, their if they decide to wander off into the donate here column, that would be welcome also.
Definitely. The resources we receive in no way can meet the needs that are out there. The needs by far exceed the resources we have. And we rely on the U.S. government funds, the foundations, but also individuals to contribute to support the work which we do with these local organizations to help them meet the health needs of their populations. So we would definitely greatly appreciate any individual, family, foundation, corporate donations that we receive. And there is a link at www.engenderhealth.org where you can sign in and make a donation to EngenderHealth to support this work which we're doing to improve the health and lives of people in the poorest communities of the world.
I can see that the work that you are doing is very important. But I wonder if you could sort of summarize for me why it is that EngenderHealth is so disturbed by the Global Gag Rule.
The Global Gag Rule has in fact indirectly denied badly needed services to some of the world's poorest people, especially women and children. EngenderHealth cares so much about the health of women and children. And so we are very concerned about the fact that they can't have access to the health services they need. And that is why we really want the gag rule to be lifted as soon as the new administration comes into office.
Well, Isaiah, I want to thank you very much. You have made it very clear that that lifting the Global Gag Rule is of paramount importance. And I wanted to turn to you, my friends and neighbors in Westchester County, and urge you, please, to go to the EngenderHealth website and sign the petition asking the President Obama to lift the global gag, to repeal the Global Gag Rule, and to ask your family and friends to go sign that petition also. It's so important that we do this one small thing which could have such a huge impact on women and their families throughout the developing world. There will be piles of pressing issues for the president to consider when he comes into office. And by keeping his focus on the need to lift the global gag, we can do a huge service to women and children throughout the world, and also to make a major step in improving, restoring the international reputation of the United States as a good friend and neighbor to the rest of the world. Thank you, and good night.